Hi, my name's Jenny Owens, and I'm going to talk about the American Counseling Association's Code of Ethics in regards to assessments. These can be found in Section E, and there's 13 points. It's very comprehensive. It covers just everything you could think of. It starts out with just general information and talks about why assessments are used. It talks about competence in using assessments, how you should be trained properly. It talks about informed consent and care in diagnosing mental disorders, being aware of cultural and socioeconomic experiences and factors, being aware of bias, selecting appropriate assessments, considering reliability, validity, and psychometric limitations, giving information to third parties so that they can choose assessments well. And if you are the third party, being aware that you are still responsible for the ethical treatment of the client, even if you are only doing scoring or interpretation of a test. Also, ethical guidelines are given for test administration, including following standard procedures, making accommodations for disabled people, making notes about those things, anything that could affect the validity of the test, any kind of irregularities or anything like that. Also, counselors are responsible for the environment in which a client takes a test. They need to make sure that it's private and safe and comfortable and free of distractions. They also are responsible for monitoring the administration of tests and ensuring that test security and integrity is maintained. We don't want to violate copyright or change the test in any way without permission. Counselors are warned about using outdated test materials, and guidelines for developing assessments are given, and detailed information about forensic evaluation is outlined. So you can see that just everything is covered. It really is comprehensive. One thing that I found really surprising was Section E5D talks about counselors being able to choose whether or not to make a diagnosis. And this is based on whether or not the counselor feels that a diagnosis could be harmful to the client or to others. So that makes sense as far as, not harming a client. But it also was surprising to me that you would be able to choose not to make a diagnosis when that was your goal in the first place. So things that are missing, a little bit more guidance in areas like that would have been helpful. Also, just like more information or details could have been given in situations like choosing not to use an assessment that's outdated. I mean, what constitutes an outdated assessment or an obsolete assessment? So I know that that's why we use supervision, and that's why we talk to colleagues and to others about these things. So all in all, I felt like this code of ethics was really comprehensive. Just thinking about being ethical, Shepris et al. Talks about ethics being moral principles adopted by a group. And, they're guidelines. They don't answer every ethical dilemma. But it just reminds me of what Peter says in the scripture about having excellent behavior, especially when we're with non-believers. But that we should remember that our good deeds will give God glory. And I think as Christians, that's really important, and that we should maintain ethical behavior in every situation.